Why Gen Z doctors, who needs to be the future of India, are being named as danger to this country by the senior most and golden generation doctors. They are saying that Gen Z doctors are not passion oriented, they don't want to work for long hours, they always demand for more money instead of doing quality work, and Gen Z doctors are moving abroad instead of working in Indian government hospitals. Gen Z doctors are careless, they are unprepared, they are social media addicts, and they have this Gen Z attitude and they are not fit to be doctors, and our healthcare system will get collapsed if they don't change. This is what the senior doctors are saying. Instead they have stamped this on this generation Z doctors. Is this the reality happening in this country? Are Gen Z doctors really a spoiled generation of doctors, or is there something else that these Gen Z doctors are working hard for their life and for their family? Let us know the truth in this video. Don't go anywhere. I will tell you everything that is needed, which might trigger you and get you angry, or you might realize few things that are important today. So this is Dr. JTM, MD General Medicine and a rheumatology resident and a part-time YouTuber, and I welcome you to my channel Dr. JTM, and we are very close to 100k subscribers, so click that subscribe button, and with no delay, let's begin it. Firstly, let us decode why these senior doctors are the golden generation doctors and the common people are saying that these Gen Z doctors are dangerous to the country. Many senior doctors say that these Gen Z doctors do not want to work for 48 to 72 hour shift. They are not hardworking at all, and they do not have a hardworking mentality. They always wanted to take rest, relax and enjoy. Compared to the old generation doctors, these Gen Z are not working at all. Their work is nothing. Yes, senior doctors and the old generation doctors may be right in their opinions or perceptions, but the thing is, these are the doctors who are the main culprits who have normalized these 48 to 72 hours of shifts. Why do the Gen Z doctors have to work for these 48 to 72 hour shifts continuously while other professions are working 48 hours per week? When it comes to the new generation or the old generation doctors are working continuously for 48 hours, for what reason? We need to respect our profession, I agree, but we also need to respect our mind and our body. When we do not do that, we see more deaths among the young doctors due to stress, due to hectic duties, having heart attacks and having bad mental health issues. Old generation doctors have normalized these hectic duties as professional service, but did not teach these Gen Z doctors on how to handle the stress in life, because they themselves don't know how to handle the stress and they got used to the stress. Old generation doctors also say that these Gen Z doctors are always choosing radiology, dermatology, cosmetology or some other end branches instead of choosing like surgery, anesthesia or any other emergency branch. They are choosing comfort instead of working hard. But the reality is, Gen Z doctors are actually choosing work-life balance and giving importance to the mental health. Yes, choosing a branch is always out of passion, but that passion also includes not just working hard or giving everything to the profession. Having personal life is important, valuing the family time is important, respecting the life you live is also important, and you need to have a life, and having your life to the fullest is also important. Just dedicating everything to the profession does not give you anything in life. You need to find that balance in life instead of just becoming that mechanical person. Common people say that Gen Z is addicted to social media. They are always doing Instagram reels, YouTube vlogs. They are always in search of fame. Instead, they can actually do service like this old generation doctors. The internet and social media is actually damaging the Gen Z brain, is what they are saying. Nice. You have done a very good analysis on the social media addiction on doctors. But to all the common people, I want to tell you two things. First thing, doing these Instagram reels and YouTube vlogs is a very small part of their life. They are just having fun, finding life and finding free time on how they can create memories in their life. Second thing, who are not social media addicts nowadays? You yourself are a social media addict. You will search everything in Google. You will see all the Instagram reels regarding to your health, and you will believe some XYZ person who is not even a doctor on social media who is doing these reels and YouTube vlogs regarding your health related issues. So these Gen Z doctors started making content educating the people, telling the real facts, what is right, what is wrong for your health. So these people are actually trying to do good for you. There is always a good and bad in everything, but how you see it is very important. Gen Z doctors might be addicted to the social media, but they always wanted to show the good in that to the people. They are always responsible, they are professional on social media like Instagram, WhatsApp, YouTube, anything it can be. Common people are saying that why do doctors always come onto roads doing strikes. They are always demanding something. They always wanted more money, more salaries, feasible duties. Doing like this is really frustrating to them. Instead, the Gen Z doctors should focus on working in hospitals. Coming onto the roads and doing strikes will actually make people's life horrible. Many patients are losing life because doctors are coming on to the strikes. Good that you are really concerned about doctors coming onto the roads and doing strikes. But do a doctor who really studies hard for 5 years and who really works hard for the next 5 years in order to build his career has to come onto roads like this for demanding what they really deserve? Do they really have to come on strikes? Why don't the governments and the system really take care of things for the doctors? Do doctors really get enough salary? Do doctors really get enough facilities? Do doctors really get enough security? Do you know there are some hospitals where washrooms are also not good for doctors? If we don't stand for ourselves, who will? Gen Z doctors stand for themselves. They stand for their work ethic. They stand for their life. They never complain that common people are not respecting them as doctors. So remember, Gen Z doctors are not going to stay silent if they are not being given what they deserve. They have given 10 years of life to you, so take it or leave it. They are going to do strikes for what they want. Medicine is no longer a service. It is just a business. Gen Z doctors have made it more selfish. To all the people who think like this, I want to tell you, or I want to make a statement in this video that yes, medicine is no longer a service. Medicine is a necessity. Your health is your responsibility and your health is your necessity. If you do not care about your health, why we should do it as a service? You spend thousands of money on alcohol and spoil your health, then you have to pay a doctor to make you healthy again. That's it. No more this business bullshit talk. Gen Z doctors are always aiming for work-life balance and mental peace, which is a basic right of life. They're always learning the new technology in the medicine, AI technology, robotic surgeries, telemedicine, whatnot, everything they are trying to update and bring it to the people. Gen Z doctors are more empathetic. They are more communicative. They are more transparent with the people or the patients when they communicate or talk to the people. When you talk to a young Gen Z doctors, you know that they are going to give you more time than any other person. Yes, there are arrogant doctors, but 80% of Gen Z doctors are empathetic and more emotional, connected to the people. Gen Z doctors are asking for less working hours. Yes, they are right, because overworking and overstressed doctors do not treat you properly. Their brain do not work properly. No, their brain is not a machine. No brain can work for 24/7. Everyone needs rest, and this Gen Z doctor's brain also needs rest, so that will make them help you better by thinking properly and make better decisions and get you the best treatment. The real problem is not Gen Z doctor, it is the system. Did you ever think why government hospitals have less doctors or understaffed? Why government hospitals do not have proper facilities? Why government hospitals do not have proper infrastructure or do not have equipment at all? In the name of service, every doctor is being exploited. They are made to do unnecessary work. Why no hospital is giving proper security to them? Why no doctor is being paid properly? It's not the Gen Z doctors who are danger to the country. It is the system that is really dangerous. Common people and these old generation doctors want these Gen Z doctors to sacrifice everything in the name of professionalism. That's not going to happen. So my final judgment to the question, are Gen Z doctors real danger to the country? Yes, if you believe that they have to work endlessly and keep their mouth shut even though they do not get anything from the system. But if you think that you need a trustworthy doctor, a doctor who really values you, then the Gen Z doctors are the future of this country. They will be getting you a better health. Blaming the entire generation doctors is not fair. Not questioning the system is the real danger. That's all for this video I wanted to share. What is your opinion on this topic? Gen Z doctors the real danger to the country, or do you have anything to say? Tell me in the comments, and also share this video with your friends and family. And if you love this video, let me get 2k likes, and also subscribe to the channel. We are very near to 100k subscribers and we need to get it, and I'll be back with one more great video. Until then, this is Dr. JT signing off.